Fellow Kenyans, welcome to the daily update on the current status of coronavirus disease outbreak in Kenya. I would like to start by highlighting the global coronavirus situation. Currently, 204 countries have reported cases of coronavirus. As of today, the global infection statistics is as follows. There are 1,021,037 cases with 751,675 people so far infected, while 53,251 have lost their lives. However, 200,013 have recovered. As we speak, United States of America has recorded 245 cases with 6,000 deaths and 10,000 recoveries. Italy has recorded 115,242 cases with 13,915 deaths and 18,278 recoveries. In Africa, Algeria is leading with 986 cases, 86 deaths, and 61 recoveries, followed by Egypt with 865 cases, 58 deaths, and 201 recoveries. In the last 24 hours, we have managed to test a total of 362 samples, out of which 12 people have tested positive for coronavirus disease. Out of this number, 11 are Kenyans and 1 Somali national. This now brings the total number of those who have tested positive for the disease in the country to 122. The 12 people have already been moved into isolation in our various health facilities. Contact tracing has commenced. To date, we have managed to test 1,433 samples from individuals currently in quarantine facilities. We are now remaining with 617 individuals to be tested. At the same time, I am saddened to inform you that we have lost another patient to the coronavirus disease. The person, a 6-year-old male child who was also ailing from other medical conditions and had been admitted to Kenyatta National Hospital. This now brings to 4 the number of those who have died as a result of this disease. The distribution of the new cases according to their counties is as follows. Kiambu, 1. Laikipia, 1. Mombasa, 2. Nairobi, 7. Nyeri, 1. In terms of gender, 8 are males and 4 are females. 9 of the confirmed cases were detected in the designated quarantine facilities, while 3 are from suspected cases admitted in isolation units in various health facilities. The ages of the confirmed cases range between 28 to 68 years. We have so far monitored 1,721 contacts, and out of this number, 1,073 have been discharged. Currently, there are 648 contacts that we are actively tracing. As we continue with our level of preparedness and response, I would like to appeal to those who are hoarding oxygen cylinders to release them. I am also appealing to various offices and business institutions to minimize the use of hard copies in their transactions and to adopt the use of paperless mode, especially for letters and other documents. In our efforts to boost the capacity in our counties, I urge for continued collaboration between members of county assemblies and governors during this period. This collaboration should foster accountability measures and ensure expediency in the procurement of services for our people, especially in our county hospitals. We have now started manufacturing personal protective equipment and masks for health workers and for initial distribution to boda, tuk-tuk, and matatu operators. Today, we are happy to have with us the Cabinet Secretary, Ministry of Trade and Industry, and she's present here, and I'd like to invite her now to elaborate on the matter of PPEs.
Thank you very much, Dr. Mwangangi, and good afternoon, everyone. The coronavirus has affected the global supply chains for a lot of goods. And chief of those has been medical commodities. So since last week, we have been working very hard to see if we can actually supply this within the country, because it has proved a challenge to trace them and to be able to order them around the world, because the demand from Europe, from the US is very, very large. I'm very excited that as we announced on Sunday, the Kenyan textile industry has risen up to the task and is currently able to produce as many masks as we require. The second thing that the local textile industry is also capable of producing and has proven that it can produce is a personal protective gear that doctors require. With me here, I have some samples which we'd like to show you. We also have some advanced progress in assembly and making of ventilators in Kenya. This morning, all these samples were presented to the National Bureau of Standards for testing and for confirmation of our compliance with Kenyan standards. And starting Monday, we will have the discharge and the receipt of the certification from the Bureau of Standards. So I'd like to encourage all Kenyans. I think we've been all directed to wear masks. And there are masks for medical personnel, and there are general masks that we can wear as we go out and in order to prevent us from getting any of these infections while we are going around our businesses. So with me, I'd like to just be able to show you some of the masks that have been approved by the Bureau of Standards and by the Ministry of Health for production. This is a 3-ply mask which can be utilized by the health professionals. But it is also good for you. So when you go out to buy, ensure that you can detect that it has got 3 plies. There's one inner layer, an outer layer. The darker part is the outer layer for gathering dust, but there will be a filter inside it. So that is something that medical personnel can wear, but also all of us can wear. I think these 3 are all alike. There may be just a simple dust mask that can be worn by everybody, including our border riders, just for dust purposes, and it will be made out of woven cloth, but that is not going to protect you against disease. It may protect you against dust and other particles in the air, but it will not protect you against disease because it doesn't have the inner filter. So we encourage Kenyans to acquire this. We have capacity from local industries, at least what I have assurance for the material we currently have in stock among our fabric manufacturers is sufficient to make 60 million masks immediately. And we have instructed them to get in touch with their distribution chains and make this available to even tailors and other people in the villages so that we can expand our capacity as quickly as possible. So the fabric manufacturers in Kenya, and there are not many, there are about 4 of them, have capacity that has been confirmed and will be distributing it over the next couple of days. And I'm certain by today, we actually have at least 1 million masks available, and I'm certain that they are already in the distribution channels. The other thing that we've been able to confirm that we can make is a personal protective gear that is worn by our doctors. This has been made in Kenya, has been certified by the Ministry of Health and the Bureau of Standards as meeting the appropriate, the necessary parameters, and can be, and this is disposable though, so these are disposable ones. And these are available at even cheaper than the imported, at a price that is cheaper than what we import. This is the same. And I mean, I think for those of you who are near it, you can hear the noise it makes, because that is part of its capacity and capability to be able to repel liquids. So that is what the doctors have tested and approved. And I think our pride as Kenyans is that we are replacing global supply chains in making these things for ourselves. It will be very helpful for the local textile industry that it can keep them employed, but I think it also helps us in enhancing our own sense of dignity as a nation, that we can produce these things for ourselves. Perhaps the next time when we meet, we'll also be able to demonstrate the approved ventilators and other equipments. Our scientists are making advances in also developing the other products that we require for medical use, and I'm certain within the next week or so, there will be some announcements in this regard. Thank you very much.
On how at the level 3 and level 4, how they're going to be distinguishing COVID and non-COVID for pediatrics, especially with the pneumonia being one of the signs of severe COVID-19. Thank you.
From the death of the 6-year-old, my name is Chongtai going from Citizen TV. From the death of the 6-year-old, how did the boy contract the virus? And of the other cases, of the other fatalities, was it as a result of pre-existing conditions, or is it the effect of the virus? And would you kindly just tell us about the counties in terms of the spread of the virus? Bwana DG yesterday mentioned that there's community transmission and local transmission. Just looking at the pockets of counties that have the cases, if you have the numbers kindly.
Yeah, please. Thank you so much. Seth Olale, NTV. Well, in terms of, let's go back to the unfortunate incident about the 6-year-old boy. There's a lot of speculation, anxiety, and fear at Kenyatta National Hospital of a possibility of those who are handling the boy didn't know until he died, and later on the test came as positive. Now there's anxiety that actually more could have been contaminated or maybe infected. What are the measures that the government is going to take to even combat that? Then the next one is about the kits that are coming, especially from abroad. Some countries we've seen have actually sent them back to the manufacturer because either they have been contaminated or they're just substandard. So what kind of assurance do you have that some of these kits that you are bringing in, the PPEs, are sufficient enough and they're up to standard? Thank you.
Right, so I think I'll start with your last question concerning ensuring that the products that we are bringing into the country are of good and sound quality. And I'd like to give Kenyans the assurance that we do have mechanisms that look at the regulation of products that come in, and more so at this critical time when we need products that will actually be able to protect our country. So we've employed and dispatched a mechanism and a system that's actually ensuring that everything that we're using in the COVID response has undergone quite intensive scrutiny and instruction through the regulatory bodies that we have in place. So Kenya should rest assured what we have here present, as presented by Betty Minor, has also gone the different qualification processes with CAS and with our medical practitioners on board to ensure that it is sound. Those coming from outside are undergoing through the same process and undergoing high scrutiny. Now, referring to the 6-year-old boy, I'll give a little introduction and then I'll ask the DG to come and bone marrow. Therefore, this child, as we've explained over and over, is that when COVID comes in, coronavirus attacks those who may have immunocompromised. Can come in and comment with regards to the count.
Thank you, and Let me clarify that local transmission and community transmission basically means the same thing. That this is transmission that takes place in people with no history of travel and no history of contact with a positive case. And based on our calculations, that is about 25 to 30% of the cases that we have so far are local transmission. Local transmission occurs in forms of clusters. And these clusters, if they are not controlled, then they merge into bigger clusters, what is the so-called snowballing effect. And that is why we are really very, very firm on contact tracing to be able to ensure that if you have any evidence of local transmission, then we go down to the area where this has been reported, make an appropriate contact tracing process to be able to ensure that everybody is brought on board. Regarding the 6-year-old who died in Kenyatta National Hospital, of course, the necessary infection prevention control measures have been put in place, including quarantining of the staff that handled this particular deceased child. We have also been in contact with Kenyatta to ensure that that particular place has been disinfected and all those patients moved elsewhere. We are in the process, of course, of testing them because you know people who are in ICU, in terms of risk profile, they are at a very high risk of contracting COVID. And therefore, we shall be able to monitor them within the necessary time period. We shall be able to deploy our testing regimen to be able to find out whether they've been infected or not, and based on that, be able to take appropriate measures. In terms of the distribution, of course, it is now we're having pockets all over. And I think we have a list we can be able to share with you from all the way from the coast to the western part of the country. And unless we take these measures that we have been talking about seriously, then we'll have more and more pockets. But if we highlight and practice the infection prevention control measures that we have highlighted, we practice social distancing, then we can be able to quickly reverse or extinguish these local transmissions and bring to a stop the transmission of COVID-19 in Kenya. Thank you. We have done capacity building for all healthcare workers in all the 47 counties. Now we are moving to the county health management teams to be able to cascade the training downwards to the sub-county health management teams. We have also been training the community health volunteers so that we practice what we call events-based surveillance. They can be able, at the community level, to pick up somebody with the symptoms of COVID-19 and bring it quickly to our attention in the various facilities so that the rapid response teams can quickly be able to come and address the issues. So triaging is part of the case management for pneumonia, for COVID, because the clinical presentation of the two is basically the same.
Okay, sorry. I've been asked to request. I think we wanted to confirm the price. A question has been raised about the prices of these masks. From the indication that we have received from the manufacturers and the retailers, and given the volume expected, we don't expect any of these masks that is available for sale to sell for more than 20 shillings. I'm sure people will be able to be very, very innovative about it, and I'm certain some prices could even come as low as 5 shillings. So, but I don't think we don't expect any of this to retail for more than 20 shillings. Thank you very much.